The National Health Foundation is a 501c3 organization. We have 3 strategic initiatives. One is uninsured children and families. The second one is chronic disease management. And the third one is systems change. And we organize all of our program activities under one of those 3 initiatives.
The mission of NHF is to bridge gaps in healthcare. Oftentimes, pregnant teens lack that access. We feel that going into the schools and creating these programs in the schools bridge that gap. The PPT program started here about 7 years ago.
It's a 3-pronged approach to teenage pregnancy prevention, working with pregnant and parenting teens, at-risk teen males, and at-risk teen girls. We have implemented these 3 programs here at Jefferson High School to help empower youth to improve their health, have healthy, safe behaviors, and also reduce the risk of a teenage pregnancy. We're at 7 high schools within South LA in partnership also with LAUSD.
The 2 things specifically that we track are recidivism, in other words, teenagers that become pregnant again, and graduation rates. NHF is happy to report that 100% of the students that went through the program last year either stayed in school, completed their GED, or graduated.
The mission of NHF is really to improve access to health care for those that can at least avail themselves of it. Peer-to-peer model of learning is primarily one of each one teach one, if you will. And in terms of patient safety first, the focus is on the medical community.
Patient Safety First is a peer-to-peer learning collaborative that accelerates the adoption of best practices and strategies for improvement within hospital walls.
The Patient Safety First program, through a series of peer-to-peer learning networks and through sharing of best practices, has resulted in some phenomenal results that we're really, really proud of. We have not only saved a tremendous amount of money, but more importantly, and the thing that I'm most proud of, is that this program has resulted in lives that have been saved.
The peer-to-peer learning actually occurs during regional meetings, where hospitals send teams of 2 to 3 clinicians to day-long learning sessions where they can learn from expert speakers. They also learn from each other, from different hospitals.
The National Health Foundation adds value to the Patient Safety First program by being an objective third party that helps us manage the program. They actually communicate directly with hospitals, they collect data, and they collate the data so that we know what the results of our efforts are, and we know what's working and what's not working.
Patient Safety First has made significant improvements in reducing hospital-acquired infections, reducing rates of sepsis mortality, and improving perinatal care.
These results translate to over 3,500 people returning to their families and not dying in the hospital, and savings of over $63 million.
Plain and simple, National Health Foundation's mission is to bridge gaps in healthcare. Hospitals in Los Angeles County are faced with a dilemma, and that dilemma revolves around discharging their homeless patients.
The Recuperative Care Center is actually a program that was set up specifically for the hospitals in Los Angeles and Orange County to have a safe discharge plan for patients that are homeless. In this particular case, the hospitals have a safe option for their patients to go to a center where there's a bed for them that's clean and safe for their recovery time.
Our recuperative care sites are staffed with registered nurses, social workers, and site managers. And it's this staffing combination that allows us to provide the best atmosphere possible for our homeless to recuperate.
First off, they get the medical oversight piece from an on-site nurse. For the duration of their time in the program, they also have a social worker that will meet with them and see what is missing in terms of their vital resources such as California ID, SSI. Ultimately, at the end, during the time of recuperative care, they're actually trying to get them connected to housing options.
To have an organization like the National Health Foundation with partners sponsor recuperative care centers throughout the community is just an incredible benefit to hospitals, patients, and solves a part of the social issues that we face with the homeless.
Over the course of the last 3 years, we now have a total of 63 hospitals that participate in using the Recuperative Care Center. And the average cost for an inpatient bed, the average was over $2,600. For the Recuperative Care Center bed, it's $250 a night.
Since our programs opened in 2010, I'm happy to report that our program has saved Southern California hospitals over $11 million.
They genuinely do want to see you get better. They genuinely do want to help you get a place to live if you're homeless. And when that happens, when you meet people like that, it does something on the inside with your spirit. If it wasn't for this place, I would be dead.
We feel that no matter who you are, your socioeconomic background, your cultural background, that you deserve access to health care the same as everybody else. Our mission is to make sure that that happens.